Yes. Magandang hapon. Can you hear me?
Yes, ma'am. We can.
Okay. Yeah, I will make it with this very fast.
All right.
Hopefully, this is just a straight listing because I would like to be able to share with you what has been happening already with the Mental Health Act. Please forgive me if I'm going to put in here updates very specific as to the different sections, because if you're going to go by the law, you have to take a look at the different sections and what are those things that are necessary, anong mandate ng bawat mga stakeholders, and that is something that I would like to share with you today. As we said, we have this Republic Act 11036, which is the Mental Health Act. And sabihin ko po, this is an act establishing a national mental health policy for the purpose of enhancing the delivery of integrated mental health services, promoting, protecting the rights of persons, utilizing psychiatric, neurologic, and psychosocial health services, and appropriating funds, therefore, and for other purposes. This was signed in June 2018, and this is decades in the coming, before this was made into law. And I also would just like to remind all of us that the objectives is to strengthen effective leadership, to develop and establish a comprehensive, integrated, effective mental health care system, protect the rights and freedoms of persons with psychiatric, neurologic, and psychosocial health needs, strengthen information systems, research, evidences, integrate mental health care and the basic health services, integrate strategies promoting mental health in educational institutions, workplaces, and communities. So these are the general objectives. And based on this, there are some things that we already did just to show you how much money we have. For 2021, we only have around 166 million for the purpose of our drugs and medicines, and 170 or 120 million actually for other activities that we need to put in place. So you can see how much budget we are getting from Congress and from the Senate for this purpose. We are working with the Philippine Council for Mental Health. We have a strategic plan, we have goals, indicators, and targets, and we hope to be able to do this by 2023. And we are governed by this type of a framework where it is a whole of society, whole of government approach, and that we are working towards the mental health and well-being for all Filipinos. We are looking at it from the point of view of people who don't have illnesses as of the moment. They are asymptomatic, they don't feel well, until those who have probably vague problems with full diagnosis, and then on to recovery. And we are using various interventions for that purpose. And we are also governed by the principle of ensuring that and reframing our mindset that when we talk of mental health, we are actually talking about an interaction. It should be done within the sustainable development framework. And it is not the work of the health system alone, it is the work of the entire government. So poverty, the kind of education that we have, the social structure that we have, all of these works together, because mental illness, mental health is really a product of all the interactions of all of these areas. So we have a vision, mental health and well-being for all Filipinos, with a mission of providing an integrated, accessible, quality mental health care program. I just would like to show you that we have goals. We would like to be able to ensure that in the next several years, mental health and well-being is valued, promoted, protected. Mental health conditions are identified, treated, and prevented. Persons affected with mental health conditions are able to exercise the full range of human rights. Kaya ang ginagawa ngayon ng CHR dito is really very important, and for us to show. And yung presentation ni Dr. Fotagana is really very important for this goal that we are now having. As I said, we have different targets. We would like the proportion of the population to have an increase, they practice self-care. Wala pa tong mga sakit ha, dapat hindi sila nag-ano ng mga drugs, they seek mental health services, they recognize that persons with mental disorders should be treated humanely. Ibig sabihin is that we are promoting and valuing and protecting mental health. There are policies and programs that are already integrated in the national local health plans. Ito po yung gusto natin. Suicide mortality rates are going to go down. Proportion of persons with mental disorders are seen and they are being treated. They are using the different services. Ito very important para sa amin ito. The number of facilities that already has an internal review board. We just came, actually, Attorney Kaliba and myself just came from a training on the internal review board that is going to be set up already all over the country for the facility so that human rights can be protected for persons with mental disorders, and that there are complaints that are acted immediately, no? And they are able to get the needed relief for that. So we have budgeted all of these until the next several years, but I would like to show you here the different updates that we have. We have an update from sections 8, 9, 10, 11, 12, 13. These are actually sections which talks about what are the safety nets that we are going to put in place so that we will be able to ensure that human rights are being protected for persons who are already within the facilities that we have. So these are, we have an informed consent guideline, we have advanced directives, legal representative supported decision-making, operationalization of these internal review boards. And this is now on pilot implementation. We will be from May to June, kaya nga nag-training kami kanina, and then there will be rolling out in the quarter one in next year of 2022. Ito po yung mga different areas that we are going to have as a pilot site. The Department of Health also is being tasked on how do we establish a community-based mental health program and facilities that is found in Section 15 and 16. We have to develop a viable, sustainable, community-based mental health program. Ibig sabihin, mga programa po natin ay hindi po dapat sa mga hospitals. Ang programa po natin ay sa community level, and that is what we are trying to establish as of the moment. Because when we talk about mental health in this country, we have to talk about how are the people, being going to become first responders for themselves, for their patients, for their families. Are they able to identify? Are they able, to provide assistance immediately and not wait anymore for these patients na lalala na? So we are putting all of this in place. We hope to be able to have that in the first quarter of 2022 also, because we have a technical assistance being provided for that. We are also establishing primary-based mental health care programs and facilities. We have been doing a lot of training activities for local government units on MHGAP, which is an intervention guide to recognize and manage common mental neurological substance use disorders, including suicide, in non-specialized settings. Ibig sabihin sa primary care, the local government units level, we are providing, augmenting drugs and medicines that are necessary. We have trained less than 48% of our local government units, and we hope to be able to train more by the end of 2023. Siguro dapat mga 100% na po yan. And then we also have developed how reporting of these services are going to be done. That's section 17 of the law. We also have provisions for ensuring that all hospitals in the country are able to provide these services. We are now working on the licensing requirements for all of the hospitals, private man yan o government man yan. They are going to be stratified, they are going to be licensed, and they should be able to provide services. No? Kahit outpatient lang yan na service, kahit anong klaseng level ka ng hospital, dapat you should be able to provide that, and that should be included in the licensing. Ito lang po yung listahan namin sa ngayon about the different mental hospitals or mental health centers that we are going still to be developing. We also have an update on mental health services for drug dependence. Of course, we are working with our DDAP, Dangerous Drugs Abuse Prevention and Treatment Program in the Department of Health. We have a training we have an algorithm on how to detect drug users, and when they show psychiatric and medical morbidities, they are being referred to proper
Okay.
treatment, psychiatric or medical otherwise.
Miss
Okay,
Presi,
so
alright.
yes.
Marami pong nagre-request ng presentations, pero dahil kapos tayo sa oras, we will make sure kung pwede po, kasi we'd like to give some time para sa mga questions mamaya. Okay lang po ba na i-wrap natin quickly para lang ho mayroon tayong presentation?
Tapos na po ako.
Alright.
We are now developing a national suicide prevention strategy, and we're doing a suicide surveillance program. We also have a playbook, and then we are engaging with the local government units. We are mainstreaming mental health in schools and in the work settings. We have capacity buildings for BHWs, and we have training programs and training activities. We have the Philippine Council for Mental Health. We have been doing all of these things already, and then we have guidelines and implementation of mental health in the workplace for the private sector, and then for the Civil Service Commission, they also have for the public sector. So all of these things are already in place, and we hope to be able to provide and make sure that ma-access po ito ng lahat. So maybe I'll just wrap up there and answer the questions that you would like to ask. Thank you so much.
All right. Maraming salamat to. That was very helpful and encouraging. Madaming mga developments, pilot testing, pagsisiguro na may mental health facilities na mas dadami pa, merong review board, etc. Ngayon po, meron tayong 3 reactors, but in the interest of time, we'd like our reactors to be brief. Ano po? Yung 5 minutes magiging 3 minutes na lang